Good evening and thanks for joining us. As we say goodbye to September, a month when Canadians got back to school and to work, there are signs this country's biggest province is not getting a grip on the rising cases of COVID-19. In the last 24 hours, 625 more Ontarians tested positive, most of them in the Toronto, Peel and Ottawa regions. It is the 7th day in a row more than 400 new people have been diagnosed. Public health officials say cases in Ontario are now doubling every 10 to 12 days. If that keeps up, they project Ontario could hit 1,000 cases a day by mid-October. Though the bulk of the infections are in younger people, case numbers are now rising in all age groups. And if older people get sick in greater numbers, that could overwhelm Ontario hospitals. They are already urging the government to reimpose tougher restrictions in the hotspot regions before case numbers spiral out of control. Premier Doug Ford says he's not ready to do that yet. Eric Sorensen has our top story.
Cracks are emerging in what has been a united front by public health officials to combat the COVID-19 pandemic. A consortium of specialists in Ontario have modeled the future, expecting a rise in cases and, more worryingly, in the need for ICU beds. Last spring, other surgeries were cancelled to accommodate COVID-19 patients. In April and May, close to 300 ICU beds were assigned to COVID-19 patients. The number fell sharply for months, but in recent days has risen to 35. The modeling consensus projects the need will keep rising this fall. If the number stays below 150 ICU beds, hospitals can manage COVID and non-COVID demands. Above 150 in the medium scenario, non-COVID cases become harder to support. Above 350, and the crisis could be worse than in the spring.
We are trying to maintain our healthcare system and, in fact, bring up our volume on procedures. Much has been discussed about the impact of closing procedures that we did back in the spring. We are trying to not do that.
In recent days, Ontario has lowered the limit on private gatherings and tightened restrictions on businesses selling food and alcohol. Some specialists say it's not enough in the face of a new wave of cases.
To sit back and watch and see how closing strip clubs and capping drinking time in bars to a few hours earlier, see how that does in terms of bending this curve. It's not plausible to me that it will have a significant impact.
Meantime, there is a growing backlog in testing at a time when more tests will be needed with children in school and flu season coming.
So this has always been about breaking the chains of transmission, always about having aggressive testing capacity and ability, and then ensuring you have appropriate contact tracing to break those chains of transmission.
Ontario's premier suggested it's a difficult balance, keeping Ontarians safe from this persistent coronavirus while also keeping the economy as healthy as possible.
You have to measure, the impacts to people's livelihoods. And so I take the economy very, very seriously. It's not the same as when we were before. We know a lot more. We're better prepared. We have the PPEs. Nothing we do is just a quick decision, bang, do it.
But the pressure is mounting from some health experts to do just that. More targeted lockdowns sooner rather than later. Eric Sorensen, Global News, Toronto.